So apolipoproteins, you know what are apolipoproteins? They are protein bound to lipids. So there are typically two types of apolipoproteins we look at. One is apolipoprotein B, which is associated with the LDL cholesterol or the bad cholesterol. And we look at apolipoprotein A1, which is associated with the HDL cholesterol. So typically when we are doing an extended lipid profile, we look at the apolipoprotein B to A1 ratio. Okay, and that ratio, if it is less than 0.7, we take it as a good factor. That means that the amount of good cholesterol and bad cholesterol are balanced at a certain level, and which is a good thing. However, if the ratio goes on increasing, that proportionately increases the risk of the cardiac event. So that is one thing. So those are ApoB to A1 ratio apolipoproteins. Okay, then we talk about homocysteine. Now, hyperhomocysteinemia or increased levels of homocysteine, they are also associated with increased risk of thrombosis. Thrombosis means clotting of blood. Okay, so these blood clots, they tend to get disseminated and they can get stuck in your brain and give rise to a stroke, or they can get stuck in the heart and give rise to a heart attack. Okay, so these small clots can be formed because of high homocysteine levels. So that is again one of the cardiac risk markers which is being very commonly evaluated, and we are seeing many cases with high homocysteine levels. Now, high homocysteine levels can be because of two reasons commonly. One is that it is familial. Okay, so because of some genetic abnormality, but that is rare. Most commonly it happens because of vitamin B12 deficiency. So if we correct the B12 deficiency, the homocysteine levels are automatically corrected. So for such cases, when we are assessing, we might also want to look at a vitamin B12 level, okay, which of course forms the second line of investigation, to actually see if they are low and if it can be corrected. Right. Thirdly, there is one cardiac marker called HSCRP. Right. Now, you must have heard of CRP. Yes. When we are having a fever or any acute condition, we look at the CRP levels to assess how high the CRP levels are. Now, there is something called as an HSCRP, which is a more sensitive marker, okay, but it is not to be done in fevers, because fevers it will be high only. Again, when the body is at a resting state, we do an HSCRP level, and an HSCRP level more than 3 indicates that a person is at a higher risk of heart attack or a cardiac event. And there is one more marker called LPA, lipoprotein A2, which is again a type of lipoprotein, okay, which if elevated is again considered as a risk factor for your cardiac health.